In this crowded market like diagnostics, Orange Health has managed to hit that 100 crore ARR number.
We are the only lab that will come to your home within minutes, give you the test results within 6 hours, which is the fastest turnaround in the industry.
You know, you're growing at 100% year on year. Give us your 3 top growth secrets.
You know, I had actually one day written it with a whiteboard marker on the wall, saying that we will not go to sleep with any customer complaint pending. India is the cheapest diagnostics market in the world. It costs 200 rupees to do a CBC test in India. Probably would cost you $200 to do a CBC test in US.
How do you capture market share in crowded markets like this?
We have too many leaders, but too few managers.
This literally blew my mind. This is the masterclass in first principles thinking.
Allergies potentially might be, funnily enough, result of like washing your hands too much.
Wow. All right. Tarun, welcome to Starting From Scratch.
I'm glad to be here. Thank you for inviting me.
Pleasure to have you. At the very beginning, one of the questions that we sort of like to ask is, if you had to give an under 60-second elevator pitch on what Orange Health is, what does that look like?
So, I mean, Orange Health is India's first at-home on-demand diagnostics lab. It's a full-stack company. And that means right from pricking your blood to testing it, we do everything in-house. It's a modern setup which is designed to give, which is basically focused on 3 things. It's designed to make diagnostics more reachable, highly responsive, and highly reliable, right? So that's what Orange Health is about, essentially. We are the only lab that will come to your home within minutes, give you the test results within 6 hours, which is the fastest turnaround in the industry. And we are also the only ones who will come to your home at night 10 o'clock.
I think what stands out the most for me is the convenience part of it, right? Like at home in under 60 minutes and reports in under 6 hours.
Yes.
How did you crack that?
Yeah, I mean, you know, just on the point of convenience, I feel like, as is always the case, I think the world solves all of these things in a reverse manner, right? Like, I think we solved convenience first for food delivery and then for other services and then for healthcare. And if you just look at it for a minute, actually, convenience is not a luxury in healthcare, it's a necessity. Up until when Orange Health came into the play in 2021, the norm used to be that less than 5% of the industry was coming to your home for testing at home. You would get slots for booking in the morning from 6:30 to 11:30. And after 11:30, no one was coming to your home because it was not financially viable to send someone home after that because you wouldn't get sufficient demand for at-home services. It's fundamentally the innovation of Orange Health. So we did many firsts in the industry. We innovated to create automated manless hubs. These hubs effectively are able to run 24 hours a day for managing logistics at 1/10 the cost of industry norm, right? And because they're automated and manless, they're able to trace the position of each sample, where they are, you know, how far they've reached. There is an algorithm and a command center controlling for the movement of samples across the country. So we are, I would say, the benchmark in the industry, probably in the world, right? To cover almost 500 square kilometers per laboratory and yet ensure that every sample reaches and hits the machine for testing in less than 180 minutes, right? Whereas the norm in the industry would be that your sample would reach the machine for testing anywhere between 6 to 7 hours, right? And because we test the blood samples faster, not only does the report come faster to you, but also the sample is much more fresher and the deterioration of analytes is lesser. So the quality is also improved. By roughly making, I think, at least like 20-30 innovations along the entire supply chain is how we are delivering 60 minutes collection and 6-hour reporting.
This literally blew my mind. It's just, I think this is the masterclass in first principles thinking. Amazing. What was that one moment for you where you were like, okay, the diagnostics industry in India is broken and, you know, we need to fix it?
We hear these narratives of saying, you know, this sector was broken and therefore, you know, I had to innovate. And what it only does, I think, is basically creates a very high threshold or a high bar for someone to start in a sector. Actually, no sector is broken. You know, like fundamentally for the last 20 years, 30 years, I think diagnostics has seen a boom and testing was happening. In India, fundamentally, testing was happening in 12 to 18 hours. If you go to US, for example, you have to wait for a result for 2-3 days. So fundamentally, you could say, oh, India is already better, right?
Yeah.
India is the cheapest diagnostics market in the world.
Right.
In the world, like even lower than LATAM, right? So, India is giving cheap testing faster than anyone else. What is there to do in this industry? There's nothing to do in this industry. It's like good enough, right? I think I didn't feel that the industry was broken, fundamentally, right? But there are confluence of factors when what is working in an industry can fundamentally change, right? So if you can identify underlying currents which are changing, right? So there are two things that are changing at a sector level in diagnostics. One is the fact that the industry is sort of consolidating, right? India is still a very fragmented sector, and I think single pathologist-owned laboratories are finding it hard to sustain, primarily because of two reasons. One is we are getting more and more complex tests into the market. Doctors are expecting those tests will be done, and the results will be given in a relatively better turnaround time, which a small laboratory will find hard to invest in. So there is a capital constraint coming in you can do basic testing, but as you do more and more high-end testing, you're not able to sustain without investing a lot, right? Talent management is becoming a problem. Doctors are getting absorbed by brands, so they're not easily available for full-time work inside a laboratory. And also with standards like NABL and all coming in, the regulatory requirements to meet are becoming tougher. So that's leading to consolidation. The other mega trend that happened in the sector was that there is this generation of consumers, which is clearly breaking away from previous consumers. So, for example, Dr. Lal, Metropolises of the world, they started expanding in 1990s, 2000s. That generation was very comfortable, was very excited by. I remember the excitement, when my parents told me about Dr. Lal in Delhi. Oh, they are everywhere, and it's just a collection center. It's not even a lab, but the results still come in the same time. I think that was the first pure logistics company in the country. That was the innovation they did. But the next generation, which is my generation, the millennials who are now coming into their late 30s, they have grown up from 2015 onwards with every service that their father took being replaced. Every service provider that their father had on their phone diary being replaced by an on-demand, on-app solution.
Yeah.
Right? So they want faster, higher reliability, and less back and forth. Right? So taxi stands have vanished. I remember in 2010s, there were taxi stands, and taxi stands vanished. There were menus in my drawer at home. They vanished. Food menus, right? So I think that generation is ready to switch. And it's very hard for a company to fundamentally change its DNA. It's always easier for something new to prop up, right? And I think that creates a very, very unique opportunity for a full stack diagnostic brand to be created, which is fundamentally at its core digital and tech first.
I want to come to unit economics now. How does the unit economics of Orange Health work right from, say, pickup to the final report delivery?
Like everyone gets into diagnostic thinking there are huge gross margins for testing, right? And gross margins are pretty good. Gross margin for testing is about 70 to 80% in market, right? And you get to that point with scale, basically through better procurement of testing materials, right? The real cost of testing in diagnostics is actually in the servicing part, which comes after gross margin, right? So the cost of collection, the cost of distribution, the cost of managing people, managing laboratories, testing, the doctor cost of reporting, those are the heavy costs, right? And you need to invest heavily on those if you want to maintain high quality and delivery, right? So while gross margins are at about 70%, I think an industry average, contribution margin after the cost of operations, right, comes to about 20-25%, right? Companies like Dr. Lal and others have done really well, right? So they have been able to take their gross margins to about at 80%, and operating contributions margins are upwards of 35%. That's why their EBIT is close to 20%, right? So that's the general step down how the industry flows. That most of the companies, good performing companies, will be able to, if they charge you 1,000 rupees for a test, they would be able to make something like 200 rupees on that. 200 to 50 rupees. Like if you had like Dr. Lal, which have very high economies of scale, you could probably make 350 rupees on that 1,000.
But it comes with scale, like you said.
It comes with scale because that dedicated cost of collections, distribution, supply chain management, doctor management, laboratory management, those are fixed costs in the system. So it takes time to overcome those fixed costs to operate at scale.
In this crowded market like diagnostics, Orange Health has managed to hit that 100 crore ARR number, and you're growing at 100% year on year. Yeah. Give us your 3 top growth secrets.
The first thing that you want to check is whether your product is right in itself, right? Which is to say that does your value proposition work? One of the fundamental challenges that you have is that you can always, take VC money and discount and grow on because of the pricing. But if there is no underlying value in the product, that your service that you're offering, right, you will get to a certain amount of growth, but you will see that there is constant churn and constant acquisition problem that you have to run through, right? Okay. Right. So for us, the value proposition was essentially speed, right? And there were questions about it. I mean, it was a thesis, right? Whether speed will work or not. A lot of people, in the beginning, most of the VCs used to come to us and says like, "ठीक है ना, मतलब like 12-18 घंटे में आता है, क्यों चाहिए?" Yeah. We are already the fastest in the world, right? Our explanation was that it's like retina display. You have LED, why do you need retina display? But once you get retina display, you will be like, why do I want LED, right? The second piece of this thing is that, quality, I think, always pays, right? So you have to over-invest in your quality and your experience so that your retention is decent. If you don't have retention, you will not get growth. So people end up focusing too much on the front of the funnel. Yeah. Right? Which is that, okay, how do I acquire more? How do I acquire more? But if you're acquiring a lot, but losing a lot, right, at the same time, then people don't realize that investing in quality, experience, and retention of consumer is actually a growth strategy. I used to have this saying, I had actually one day written it with a whiteboard marker on the wall, not even on the whiteboard, this thing on the wall in my office, saying that we will not go to sleep with any customer complaint pending.
Wow.
Okay. And even to this date, every customer complaint comes to my desk. That's the first thing I check in the morning. The third and the last thing is, I think you have to figure out the distribution channels in the ecosystem. So in Orange Health, for example, we work very closely with doctors. We came to the conclusion very early on that, people have different views and it depends on what you're selling. So for example, Tata 1mg, Healthians, and Thyrocare. I actually think of Tata 1mg and Healthians as the new age Thyrocare. Yeah. Right? They are selling preventive health package. Their distribution strategy is to go online and sell at discount, which is fine because you have low morbidity use case, right? So it doesn't matter, like I want to optimize, I'm not dying, nothing is going wrong with me. So, just health checkup at lowest price is my best option. And therefore my distribution is best on online segment where price hunting is easily done, right? I win on that distribution. For us, being sickness oriented, it's very important to be working with doctors. So we worked a lot hard on putting up a team on the ground, going and convincing doctors on quality. We focus a lot on doctor acceptance of reports and convincing patients at point of care that Orange Health is a reliable brand, right? This is what I will say essentially, right? Like get a good CVP that works despite not discounting. Ensure high retention by...
Sorry, CVP is customer
value proposition, right? Get high retention through exceptional investments in quality and delivery, right? Your delivery and quality has to be exceptionally good. Right? And then co-opt the ecosystem with you, see how the industry currently distributes this thing, right? If you decide to undercut the current distribution network of the industry, right, you better have your strategy right. Yeah. Right? But if otherwise, make sure that you co-opt everyone who is part of the distribution network, either in terms of usage or in terms of actually selling your product, right? So these are the important pieces, I would say, critical for growth.
Brilliant. CAC is such a buzzword, right? Like, and I feel like acquisition is such a focus area for every startup. But this little nugget here is where I feel like a lot more of the energy and attention should go to.
No, we have excellent people working on the revenue side, right? And in acquisition side and all that. But at the end of this point, right, the differentiation is not there in terms of how you acquire the customer. The differentiation is in your product. And I think the founders should spend, reviewing the revenue side of the functions, but building the right experience in the product. So we have what we call as the P.U.R.E principle in Orange Health.
Okay.
So the P.U.R.E principle stands for the order of priority in the company of action, right? So P stands for like people, which means that our frontline operators, the technician, the e-medics or the phlebotomist or the doctors or the customer service representative. These are the frontline people.
Yeah.
We have to solve for them first. Because if they are enabled, they will be able to solve for what is next, which is you for user experience.
Yeah. Okay.
So if they are enabled and their service is automated, they are low on stress, they can take decisions using our tech on the spot, right, and give the answer to the customer.
Yeah.
Then the user experience improves.
Yeah.
And then if the user experience improves, then revenue will come, which is R.
Yeah.
And if revenue will come, because we're a highly leveraged business model, I told you, unit economics of scale apply to us.
Yeah.
EBITDA will come.
E is for EBITDA.
Yeah.
Okay.
So it all starts from P, U, and then goes on to RE, right? If you start solving for R before P and U, right, you will lose the plot.
Wow. I think the frameworks that I'm hearing from you are just like, I feel like that is only such a big moat. Like, it's just incredible. How are profit margins of a basic test like a CBC different from the higher end tests?
Okay, so there are two pieces on this. I think at its most fundamental, I mean, the gross margins are kind of similar only, right? Okay. The difference comes from actually the volume of the test. So for every test, you need to run a series of quality checks, right? Those quality checks are expensive. Okay, and you need to run those quality checks multiple times during the day so that your results are correct. Right. So to overcome that fixed cost, right, you need volume. And then your gross margin improves. Otherwise, you're wasting a lot of money only on making sure that the quality is correct. Right. This is even more so the case with high-end tests. Right. The thing is that CBC can be sold today at something like 200 rupees with still having 60-70% gross margin, simply because there is so much volume. Whereas, let's say a high-end hormone test would be sold to you for 2,000 rupees. It might actually have only 50% gross margin or 35%, 40% gross margin. Why? Because the same thing applies. The quality of testing cost is high. And on top of that, while you do CBC 10,000 times in a month, you do that test 100 times a month.
Right.
So you have to recover that cost of quality. That's why that cost is higher. But because I've charged you 2,000 or 3,000 rupees for it at 50% or for 30% gross margin also, in absolute terms, it contributes more money because everything below is fixed cost.
Right.
So that's how this works. So CBC might be making 70% gross margin, but it's being sold for 200. So it's making 140 rupees per test. Right. If you're charging a high-end hormone test for 2,000, you might be making 30% margin, but I'm making 600 rupees per test.
Got it.
And that 600 rupees coming to all the fixed costs below.
Right.
So that's how it works. So gross margins are actually not that necessarily that better. Right. But it can contribute better because of higher volume. Of course, with companies like Dr. Lal, Metropolis, they have these hormone tests also running at thousands of tests per month. So they are able to extract even more out of margins. So their margins go really high. That is why at scale, when you sell specialized tests, your gross margins improve to 75% because of these high-end tests. Like outside of top 50 tests, these other tests start making more money for you.
Right. So once you hit that escape velocity of scale, then the real
real benefit kicks in.
Yeah. There's a significant difference between how healthcare is costed in India versus the West. How much is the difference?
Huge. Just to give you an example, it costs 200 rupees to do a CBC test in India. It probably would cost you $200 to do a CBC test in US.
Oh, wow.
And even on PPV basis, that's a 10 to 15x difference. So it's huge. It's very, very large gap. Part of the reason is why how healthcare works in US and abroad. I think it's run primarily in India. India is a consumer-driven market. It all spends are out of pocket. So market aligns with the ability to pay of the consumer, and therefore all optimizations, innovations happen in that direction, right? US is a highly payer-driven market and highly litigative market, right? So costs of litigation are baked in. So low trust, high litigation from that perspective. So the cost of litigation and all these problems are baked in to the system, right? So you want to be oversure of everything. There are higher overheads of maintaining legal teams. Therefore, they will charge the payer. Payer is not directly representing the consumer, right? And anyway, if something is priced higher in private market there, it is to the benefit of the payer, because while the payer will negotiate the price to be $150, even if the market is $200, the consumer is in a trap to say that, okay, I cannot afford $200, so I will take the insurance from the payer, right? So in my mind, actually, it's not entirely clear also. I mean, this is a more healthcare specific point that I'm making. It's not particularly clear if 100% penetration of payers as an insurance or 100% service by government like NHS in UK has necessarily worked out well for the consumer. Some degree of private competition in direct to consumer space is very valuable, right? Net effect outcome has been that US, UK, developed markets are supply constrained, highly expensive, and not very reachable, so to speak, right? Unless you have an insurance.
It's like we're cheapest by miles, and I think I've heard this from a lot of friends who stay abroad, right? Like
we're cheapest and we are more accessible.
Yeah.
Right? We are faster, we are more available. I mean, we, technically speaking, they are a country of 300 million, right? Why does it take them 48 days to report when in India, where we are serving 1.4 billion, it takes us 6 to 12 hours to report, right? Why does it take you to get time to get an appointment in UK, US for a doctor? It takes you anywhere between, like in UK, for example, in NHS, people say that a dentist appointment can be about 2 months away, right? Here you go into walk into a dentist, right? How is this possible? Right? They have become supply constrained, essentially.
Quite terrifying. I mean, it's a fairly crowded space, right? Like what Orange Health operates in, you giants like Dr. Lal that you mentioned, you have Apollo, you have, Tata 1mg, etc., entering the space as well, the newer players as well. How do you capture market share in crowded markets like this?
So I had, I don't know if you would remember how Pulsar won the market.
No, I just remember it becoming a boom overnight.
Right? First marketing brand line for Pulsar was definitely male. The entire advertisement was around that.
Wow.
Right? So everyone before that used to say Meri bike. There was a female pronoun usage for a bike before that.
Wow.
And they basically pushed on the fact that young teenage guys or late teen or early 20 guys are now buying bikes. It's not a family bike anymore. Okay. They are the ones who are entering the market. And then you have to drive a wedge, right? And driving a wedge essentially is about like what is the value proposition that speaks to that generation, right? Which is the point that I am making. I made in the beginning also, right? That there is a generational shift that has happened for replacing everything that was old with more responsive, more direct brand, on demand, at home, quicker solution, I get my pizza quickly enough, but when I'm sick, I need to make 40 different efforts to get myself tested, right?
Yeah.
So that wedge has come, the generation is changing, and then that's how you enter a market which seems crowded, but actually for that particular consumer segment, there is no option.
Yeah. Yeah.
Right? And they're just aching to move on. It's like saying the new generation is aching to move on to Snapchat because my parents are on Facebook.
Yeah.
Right? So same will happen with Instagram and all of those things. So I think there is no permanent position that you can hold in a market, and there will always be cuts opens in markets which you need to
drive a wedge through. Yeah.
So from far away, everything looks like, okay, this is so crowded, right?
Yeah.
But how do you see so many brands in every category? Because there are spaces in every brand. There is spaces in every category that every brand can occupy. No one has to die for one to survive.
Yeah.
Right?
Yeah, absolutely.
Orange Health also will be alive, and Metropolis will also do well, and Tata Energy will also do well.
Right.
But these are different positions that everyone has taken in market.
What are some diseases or deficiencies that you're seeing emerge, especially in the Gen Z population in India?
So, interestingly, people used to make fun of developed countries. But one of the rising incidences that we see a lot in now Gen Z is allergies in India. There is a scientific hypothesis as to why allergies come up. So it's basically an autoimmune reaction. So allergies are increasing a lot. Gut-related issues are increasing a lot. Nutritional deficiencies are increasing a lot. Vitamin and minerals deficiencies are increasing a lot. There are increasing incidences of cardiac-related issues. Sudden cardiac arrests, cardiomyopathy increasing. Just out of very early age issues, right? Linked to it are issues around metabolic conditions like high sugar levels. Diabetes is an increasing trend with Gen Z. So I think overall there is a series of things which are actually showing up as increasing in number in these things. Some of these are very new, like allergies and all that. Allergies potentially might be, funnily enough, a result of like washing your hands too much. The autoimmune, it might be a side effect of we used to have worms and pests in our body because of like some degree of interaction with nature. And our immune system basically had certain aggressive tendencies to fight these things because they are hard to kill. But because we have gotten good at hygiene and worms and pests have stopped coming into our body relatively lesser so now, right? There is a tendency for that aggressive part of the immune system to react against things which are worms and pests.
Wow.
This is an hypothesis which has been presented. Which is an interesting hypothesis, I thought, right? Like there is no escaping one problem from another.
Yeah, incredible. But yeah, awesome. I think that brings us to the end of it.
Great. Thank
you so much for being here. This was an absolute masterclass. I've only rigorously taken down notes. Such a pleasure having you over.
Yeah, pleasure. Thank you so much for calling.
Thank you.
My pleasure. Thanks.